Hi good people, welcome back to the Nursing Moms. I'm Nurse Janet, and in this video here today I want to talk about urinary tract infection in pregnancy, also known as the UTI. Why is it so common in pregnancy? How can it be prevented? What are the treatment methods, and what effects does it have in pregnancy? Stay tuned and watch to the end. Urinary tract infection is a bacterial infection affecting the urinary system, and the urinary system includes the kidney, the ureters, the urethra, and the bladder. This infection can get both men and women, but again, it's so common in women due to the physiological nature, how we are created. What are the signs and symptoms of urinary tract infection, especially in pregnancy? During pregnancy, if you experience any of the following signs and symptoms, then you should go and see your doctor or seek medical attention. Number one is an urgency in passing urine. You just want to pass urine more often, like you just from the toilet and you are not yet relieved. You feel like going back to the toilet again. That is one of the signs of urinary tract infection. The second one is burning sensation or cramping of the lower belly. After peeing, you realize you have it's like it's burning, and again, your lower abdomen feels like it's dull, it's cramping. That is not okay. If you have cloudy or dark urine, that is another symptom of urinary tract infection. If your urine has bad odor, actually there is specific smell for the urine. And if you realize that your urine is not smelling the way a normal urine should, then actually you need to seek medical attention. Pain on passing urine. This is very obvious. Actually, if you're going to the toilet and you realize that the process of passing urine feels so painful, at times you can even refrain from going to the toilet due to that discomfort and pain. Actually, it's not okay and you really need to go and see a doctor. Why is urinary tract infection usually common during pregnancy? There are several reasons why you realize that treating urinary tract infection in pregnancy can be something like, okay, you've treated it this time and again there is some reoccurrence, or yeah, why is it so common during pregnancy? During pregnancy, there is always too much hormonal changes in your body, and this can always lead to having urinary tract infection. And again, during pregnancy, your urine contains much of proteins and sugar. All these attract bacterial growth, which can always lead to having infection on the urinary system. During pregnancy, remember your growing belly will be pressing much on your bladder, making it very difficult to completely empty the content, that is the urine. So there is always a remain of urine after every peeing cause. It cannot be completely emptied. Remember, this stasis or remained urine can always lead to having urinary tract infection. And again, if you are not taking care of yourself, like wiping from front to back, there is high chances that you will introduce bacteria like the E. coli, which always can lead to urinary tract infection. How can we treat urinary infection in pregnancy? Urinary tract infection in pregnancy is treatable. There is safe antibiotics that can be used during pregnancy to treat urinary tract infection. The key thing here is to have good compliance, like you should adhere to the treatment to completely eradicate this problem, because it can be reoccurring if you've not completely treated it, and it can prolong or it can lead to other complications during pregnancy. Antibiotics like amoxicillin and erythromycin have been found to be safe and effective in treating urinary tract infection during pregnancy. What are the effects of urinary tract infection in pregnancy? Any infection during pregnancy, if not treated, can always impact negatively on the health of the mother or the baby, and UTI is not an exemption. So UTI must be treated completely for safety of the mother and the baby. There are several effects that can happen, or complications or negative impact on pregnancy caused by untreated UTI. If not treated, urinary tract infection can lead to preterm labor, leading to low birth weight or even preterm baby. It can also lead to anemia. Urinary tract infection can have impacts like long-term infection actually if not treated well, and it can also lead to severe infections like effects on the kidneys, which can always be fatal or having serious complications during pregnancy. So it is very important to treat urinary tract infection during pregnancy. How can we prevent urinary tract infection during pregnancy? Preventive measures are always very important and should be taken seriously. And again, we should know that every pregnant woman is at a risk of getting urinary tract infection due to the obvious reasons that I mentioned earlier. The preventions that we can always do at home includes rehydration, like getting yourself enough water, at least 8 glasses of water per day is very important. It's also advisable to empty your bladder a few minutes before and after sexual intercourse. On wiping yourself, you should always stick to the front to back wiping, actually not to introduce the bacteria from your butthole onto your urethral orifice that can always travel upwards, causing urinary tract infection. And again, you should avoid things like douching. Yeah, you should always empty your bladder when necessary. You should not hold on urine for a long time. If you feel like peeing, actually go and pee. You should not hold on to urine for quite a long time. And another thing, you should avoid those strong feminine deodorants and washes. Avoid tight pants. And thanks for watching, and bye. And again, if you find such videos interesting or educating you in a way, kindly show some love by liking, subscribing, and maybe sharing. Yeah, let's meet in my next video. I'll be sharing something different. Bye.